Dr. Jen. I'm a fertility doctor, and I have patients ask me all the time which embryo is best for transfer, which will have the highest pregnancy rate. So I recently had a patient who had 2 embryos that were tested. They were tested by something called PGTA, which tells you chromosome number. So if an embryo has the correct chromosome number, it's going to give you the best chance of pregnancy. So her embryos were both what's called euploid, so they both had the correct chromosome number. But one embryo was frozen on day 7 and it was rated as 433, and one embryo was frozen on day 5 and it was rated 421. So even though they're both euploid, or sometimes that's called like normal, they're going to have different chances of pregnancy, because the one that's frozen on day 5 with a better rating has a higher chance of pregnancy than the embryo that was frozen on day 7. Day 7 embryos, basically it means they took an extra day or 2 to make it to the blastocyst stage. So it's that big soccer ball stage where they're frozen and can be tested. So usually most embryos are going to make it to that stage on day 5 or 6. And if it takes an extra day for the embryo to make it to that stage, so if you have an embryo that was frozen on day 7, the chances of pregnancy are going to be lower for that embryo. So it's important to know that not all embryos that are rated as euploid or normal have the same pregnancy rates. So for this patient, if she wants a higher pregnancy rate, then I recommend that she transfer her day 5 embryo over the day 7 embryo, even though they both came back euploid or good on her testing. Let me know if you have any other questions about this.